wants to do a little bit of the Bellafill. We're going to focus on the little lines through here. Now, we talked about laser, we talked about tighten. Hold this for me. And the benefit, of course, doing the Bellafill, there's no downtime, and that is a permanent filler. So today what we discussed is I'm going to thicken the skin through here and try and treat as many of these creases as I can. And then I'm also going to plump a little bit. You know, we get a little bit of the valley here. If I build that, it reinflates those areas. So we're going to use 4 syringes today, and I'm going to thicken as much of the skin that I can here. So that's our focus for today. Okay, any questions about our goals?
No.
Okay, very good. I'll hold this for you. And you can see we've got her pictures over here. So these are the before pictures, and then of course we'll compare those to the afters. For the physicians and students that are watching, I like to use the Hiba Cleanse and the alcohol swab. Can you open that for me, please? For cleansing on the skin. So let me have you rest your head all the way back. So Donna, what was it that inspired you to do a cosmetic treatment?
Well, I've done them in the past, and then moving here into the Tampa area, I had always done, I did a full facelift about 12 years ago, but then I did fillers, and I'm just sick of the fillers.
So people,
every 8 months, every 12 months, injections, and so when I heard about Bellafill, and then I started looking at who did it, and you come up as the top.
we have the smartest patients. When they research us online, they always find us. So glad that you're here. We'll take great care of you. So I like to use my little buzzer device here. So I'm going to do a little bit of the numbing medicine.
Can this back go back a little bit? It's a little uncomfortable for me to. Yeah, that's much better.
Is that good? And
yeah,
raise
that's
your
good.
feet up.
That's good.
Does it feel good there?
That's fine.
If you need to adjust, you let me know. So I use the little buzzer device. So I'm going to turn your head this way just a little bit. So you're going to feel buzz and then pinch on 3. 1, 2, 3, pinch. So we're doing a little bit of a field block. We'll go slowly. It's a little sensitive, but once I do the numbing, and it's easier for her to tolerate the fillers. You feel small, medium, big pinch, not too bad?
No, not bad at all.
A little bit of numbing. We're not in a hurry. Buzz and then pinch. 1, 2, 3, pinch. A little tender. So I like to use some of the subcutaneous lidocaine injection because it does make it much more comfortable, and then you can concentrate on the injection. The patient does need to be comfortable. It's hard to get as good of a result if you're not keeping the patient comfortable. I do have laughing gas too, but most patients don't want that, and I can use Valium, but if you use Valium, then you need a driver until pinch.
Right.
So again, most patients don't want to do that. So a little bit of numbing. This is lidocaine. My team has everything set up for us perfectly. Ari's our camera work woman, and Yesenia is our setting things up. Thank you, Yesenia. Makes it so much easier for me.
Sue said, "Hi, doctor."
Hello, thank you for watching and thank you for sharing. We're on a mission to stop bad plastic surgery, and people are not going to make good choices until they know their options. So that's why we're here.
Tina Sharp says, "My favorite doctor ever."
Thank you. You're so sweet. Thank you for watching.
And Tina's
my mom.
Oh, that's wonderful. Yeah, we have Anastasia's our student here today learning. She's going to go to medical school. And her mom is watching her video. So there you go. We have a lot of students that come through, and we're all in this together. So a little bit of numbing. Do you feel small, medium, big pinch there? Not too bad? Okay, so the numbing medicine first.
I've never been numbed for injections ever.
Yeah, it's definitely an easier way to do it, I think. Let me turn your head this way. You'll buzz and then pinch. 1, 2, 3. Pinch, little pinch there. Sorry. Usually we will have a little bit more sun damage on the left than on the right because when we're driving, little pinch, we get more sun exposure from the driver's side of the window. Pinching. So we'll go slowly, and she's going to feel it get a lot more numb there. Everything's looking good. Perfect.
How long does a minute lift last?
With the lifting procedure, people usually wait 5 to 15 years before they say maybe they'll do another. Some come back after a year or two. Some wait 20 years. It just depends on how we take care of ourselves, how we age. We go through growth spurts. We go through aging spurts. But it is variable because our lifestyles are variable. That's a great question. So you feel buzz, pinch on 3, 1, 2, 3, pinch. All right, pinching. We'll go slowly. We're not in a hurry. Do you feel small, medium, big pinch there? Not too bad?
No.
Everything's looking good, and I am feeling where, and I'm also directing the tissues as I'm injecting. I can direct where the numbing medicine will go. I'm primarily going to use the needle to inject intradermally to thicken the skin. How about here? You feel a little pinching there?
No, not bad.
Thank goodness for lidocaine. It starts to have a nice effect, pinching. We're located in Tampa, the Villages, Florida. Come out to one of our seminars and learn more, or come in for a consultation or a virtual consult. And now I'm going to test on the other side.
Starting to salivate. Is that normal?
It'll feel like, you
Yeah.
might feel that salivation. Sometimes it feels like we may be drooling, but there's no drooling, I promise.
Okay.
Because the numbing makes the lips feel goofy. You feel a little pinching here? Not too bad?
Nothing.
How about here, pinching?
A little, but nothing. Like,
Just a little pinch here. So now I'm just testing these areas and giving a little bit more numbing. Little pinch. Same thing on this side. Turn your head this way. Little pinch.
I still feel that.
You feel that one, yeah.
The whole side feels more sensitive.
Always one side's a little more sensitive than the other, yeah. And I'm numbing a little bit more here because there is a little bit more sun damage on this side. So, okay, so now that we've done pretty much the majority of numbing, and there is some numbing medicine inside of the Bellafill too, so that helps us out.
What about bruising after the procedure?
So usually after fillers, you'll have little or no bruising.
Good.
But if you bruise, it can last for 4 to 7 days, so it can cover with makeup. So bruising happens. Try and stay off the blood thinners, off Motrin, ibuprofen. Let me turn your head this way.
I'm not a big bruiser.
Well, that's good. So this is an intradermal injection, and you can see the little creases. They do improve. And I'll use the shiver technique because that allows me to get a small amount of the filler over a large area. So there's a few mechanisms at play here. Number one, we are mechanically, physically widening the skin, thickening the skin to try and thicken the crease. Number two, there's collagen stimulation from the Bellafill, and that collagen stimulation will help a little bit with the creases. And then just more volume will flatten out and plump some of these creases. We can't make them gone. It's not the same as laser. She feels a little pinch there. But we want to make them as good as we can. We've got 4 syringes today. A little pinching there. But you can already see it's a nice improvement on what we've started with.
So Carla is saying, it seems like the lift is good, but fillers need it.
Seems like the what?
The lift is good, but you still need fillers?
Well, it
How
depends on how good of a result you want. If you want your best result, we combine the treatments.
Okay.
And the fillers and lift do not replace one another. So that's important to understand. Because we can get remarkable results that they really could not achieve 30, 40 years ago. Okay. Everything's looking good. How are you feeling, Donna?
Great.
You feel big pinch, little pinch, not too bad there?
Not bad at all.
So again, I'm just trying to fill out these little creases, thicken the skin. Little pinch there. This is an intradermal injection. Cindy, if you could just squat here for me, please.
You see the difference? Really?
Looks amazing.
It's amazing.
So Donna is going to pass the grocery store test today. If she walks into the grocery, no one does a double take. Let me turn your head this way a little bit. So we're going to focus on some of these deeper creases. So this is very much artistry, right? There's no, you can't make things perfect. A little pinch. And some of this is going to go intradermal. Some of it will go a little bit subcutaneous, but all of it helps. And when I do the shiver, that allows me to put a very tiny amount of filler over a large area. Or when you're injecting intradermally, you need a little extra bit of pressure because it's tougher. She feels a little pinch there, so we're going to numb it with some numbing medicine. And I'm going to grab one more of mine. So we're using Bellafill today for treating. This is a similar technique for acne scarring. And if I get my needle clogged, then I will clear it out, or you just replace the needle. So when we see the results back in a couple of months, if we're happy, we leave things be. But if we want to add more, we can always add more. Better to come back another day and do more rather than go too far. Pressure pinch. Little pinch. Little pinch. Every little bit helps because we lose that volume in that collagen. How you doing, Donna?
Good.
She's tough.
Great.
We try and make it easier than the dentist's office. Now I'm going back to the other side. And even if I didn't inject anything, just passing the needle gives us a little bit of, so you'll feel a pinch here on 3. 1, 2, 3. Pinch, sorry, pinching there.
Okay.
Under there. That's why we say you don't want to taste the chocolate cake before it's done baking. Everything's looking good. Little pinch, 1, 2, 3, pinch. Tender. 1, 2, 3, pinch. Just chasing a few of those extra little creases. I like to recommend that 5-minute massage 5 times a day for 5 days.
That I do myself?
Correct. And I'll show you how. You cannot hurt the product.
Okay.
Don't. Let me turn your head this way. So you can see these areas clumping out a little bit. Little massage. Massage does not move the filler. It just kind of softens the area where you put it, evens it out. Little pinch. 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 That's fine. If you could combine all of that into this one, please, for me. Into the 3cc syringe, thanks. So really a nice improvement. Make a big smile for me. Looks good. Now relax as best you can. Bellafill is a common choice because the most expensive filler is the temporary. You have to keep replacing it. So patients, they don't want to keep wasting money on temporary fillers, so that's why the Bellafill does such a great job.
This is also a pain test before I do anything else.
How are we doing so far?
Fine, I'm fine. I think I could tolerate the laser.
Well, you had mentioned too, when you had laser before, they didn't numb you and you could feel it.
No, they took a topical numbing.
The top, it didn't help very much, did it?
No.
Right, when
not
I
at
do
all.
laser, you numb the skin so you don't feel it. So topical numbing for laser doesn't work. I'm sorry that happened.
Right.
It wasn't here, but that's why we do things differently. So a little bit of swelling, I like what I see. I'm going to turn now. I'm just going to
Even
build
with
a little-
injections, I've never had numbing like you do.
Yeah, we have our technique. Feel a little pressure pinch.
I didn't feel that.
Feel a little pinch in there.
Now I feel it.
And it's going to numb. How about here, a little pinch? So now I'm focusing on deep to build up that volume and re-inflate. And I still use the shiver technique because the goal is you want a small amount of filler over a large area. That's the outcome. Turn your head this way just a little bit. Pressure pinch.
How many of these have you done?
I've done over 20,000 syringes of injection. You get the hang of it after 20,000. Little pinch. That's a little subcutaneous, so she feels a little pinch there. We'll go slowly.
Going
Very.
to the bone, it feels
We're right on top of the bone. I like to do some of it on top of the bone and some of it right below the skin.
Okay.
So I mix that up. Everything's looking good. Okay, so we're completely done. Hopefully that wasn't too bad.
No, not at all.
So even though there's a little swelling, you see how it looks good, but then the swelling is going to go down, the collagen is going to build. Can you see how it's
Oh my
softens?
gosh.
You like what you see? A little bit of
Absolutely.
puffiness, and I'm not worried about that because we use about 6 cc's of lidocaine and we use about almost 4 cc's of the Bellafill. So that will, now hold this for me. So this is how I like to, 5-minute massage,
Okay.
5 times a day
Pressing.
for 5 days, up, down, side to side, back and forth. Make a big smile for me, big smile. It looks good, it looks natural, it's going to keep getting better, so we'll see you back in a couple of months. The lips may feel a little goofy because
Right.
there's numbing,
Right.
and that numbing will go away in about
Okay.
30 to 60 minutes.
Now
Any-
I have ice pack. Can I put that on
use
as
the
I
ice
drive?
pack and that's fine.
Okay.
Any questions?
No, great. I love it.
Congratulations, we'll see you back in a few months.
All right.
I'll give you the hugs and hugs
Okay,
from here.
the COVID hug.
The COVID hugs from here.
Thank
We are on a mission to
Okay.
stop bad plastic surgery. We're here to help you raise your standards and do things the right way. Give us a call. And a question for you too, since we've been talking about this, I wore my Stop and Smell the Roses suit, but we want to hear from you. How did we do? Are the shoes okay with this? Did we do a good job with the shoes? So thank you for watching. We'll see you in the next video. I'm Dr. Rich Castellano.